Good day all. This talk will look at the Marxist approach to health and healthcare. This is an approach which begins not with Karl Marx himself, but with Marx's friend and collaborator Friedrich Engels. Engels wrote a book entitled The Condition of the Working Class in England, published in 1845. In this book, Engels was the first to collect facts and figures to show that the condition of the working class in England had massively deteriorated with the coming of industrial capitalism. Through the late 18th and early 19th centuries, among the English working class, many diseases had become rampant, health had declined sharply, and life expectancy had fallen. Engels argued that this had been caused by industrial capitalism in two main ways. Firstly, industrialization led to urbanization. Millions of people migrated from rural to urban areas in search of jobs. This led to massive overcrowding and inadequate housing and sanitation in cities that were not ready for such a huge influx of people. Under such conditions, cities became breeding grounds for disease. Secondly, said Engels, capitalists always seek to maximize their profits by paying their workers the lowest wages that they can. This meant that most workers could only afford the cheapest housing and the poorest, least nutritious food. This combination of poor infrastructure and poor wages led to the rise of urban slums, where the working class lived in conditions of inadequate shelter, sanitation, and nutrition. The inevitable result of this was a rise in disease and a decline in health. Fortunately, the 20th century saw significant improvements in the working class's wages, living standards, and living conditions, and so in their health. However, Marxists like Vicente Navarro argue that there remains a built-in contradiction between the capitalist's desire to maximize profits and the workers' desire to maintain good health. While wages have risen, this is largely because the workers have created organizations like trade unions, which have forced capitalists to concede those higher wages. Capitalists still try to pay their workers as little as possible by preventing unionization, turning full-time jobs into part-time jobs, de-skilling the work, and so on. Poor wages still lead to poor living conditions, and urban slums still exist. In addition, capitalists generally have no regard for the health or safety of their workers. Workers are regularly forced to work in unsafe and unhealthy working conditions. If they refuse to do so, they're simply fired. Corporations routinely refuse to spend the money necessary to install proper safety equipment and safety procedures. The result is that many thousands of workers all over the world are killed or injured every year in preventable accidents. In addition, poor working conditions cause a host of more long-term health problems: respiratory diseases due to poor ventilation, exposure to toxic chemicals and/or radioactivity, heart problems, and so on. While trade unions have fought for better and safer work environments, their successes have been limited. Even when they pressure governments into passing laws imposing health and safety regulations on businesses, those laws are rarely enforced properly. Corporations also often ignore environmental regulations, leading to pollution and environmental degradation. Air, water, and land have all been poisoned by capitalist businesses through industrial byproducts and dumping of toxic waste. The World Health Organization estimates that about 90% of the world's population now breathes polluted air, and that every year air pollution kills over 20,000 Canadians and over 7 million people globally. On top of these deaths, air pollution also causes a variety of health problems, particularly respiratory and cardiovascular ailments. The World Health Organization also estimates that about 30% of the world's population drinks polluted or contaminated water. This causes diseases like cholera, dysentery, typhoid, polio, and diarrhea. In the West, diarrhea is just a minor inconvenience. But in the Third World, it kills over 500,000 people a year. In addition, plastic is polluting our rivers, lakes, seas, and oceans, and is choking the world's fish population to death. On land, toxic waste is often dumped without proper containment, so that poisonous substances gradually leach further and further into the surrounding soil. Farmland is often affected by this, and the toxins are sucked up into the plants by their roots to be eventually eaten by people. Similarly, pesticides, which are essentially chemical poisons, are not just sprayed on the plant, which you can wash off. They're also sprayed on the surrounding land and are sucked into the plant by the roots. As a result, industrially produced foods often contain a variety of harmful chemicals. The short-term effects of pesticide poisoning include nausea, vomiting, and headaches. The long-term effects include permanent damage to the nervous system, reproductive disorders such as sterility, miscarriages, and birth defects, and various kinds of cancer. In the late 20th century, a growth in awareness of this problem led to the rise of the organic food industry, which grows food without the use of chemicals. This has become a multi-billion-dollar industry, but it still only accounts for a small fraction of the food consumed globally. In addition, businesses regularly put out products which are harmful to the health of the general public. These range from improperly tested pharmaceuticals like thalidomide to improperly tested products like asbestos insulation to products known to be harmful like cigarettes. Since the 80s, most Western states have adopted a policy of deregulation, which consists of scrapping most of the regulations which previously constrained corporate activity and essentially allowing corporations to do whatever they want. This has opened the door to a myriad of potentially harmful corporate activities. In the field of healthcare, it has, among other things, led to a steady reduction in mandatory testing times for new medical technology and new pharmaceuticals. The general public have, in effect, been made into corporate guinea pigs, used for the testing of long-term side effects. For Marxists, health and healthcare mirror the class structure of capitalism. The higher your class and income, the better your healthcare and the better your health. Decades of statistics show a clear and consistent relationship between class and health. The poorer you are, the poorer your health is in every category from cradle to grave. It begins with higher rates of stillbirth and infant mortality, continues with higher rates of accident and disease, then higher rates of environmentally caused illnesses such as respiratory ailments and even parasites, then higher rates of mental illness and even cancer, and finally, shorter life expectancy. In Canada in the 2000s, studies found that poor persons living on minimum wage simply could not afford to maintain adequate standards of nutrition, sanitation, or healthcare, and so naturally they had the poorest health. Now that capitalism has undergone a process of globalization, these same inequalities can be seen on an international scale. As of 2021, most Western countries had an average annual income that ranged from $30,000 to $90,000. For example, the US's was just over $70,000, Canada was just under $50,000, and Britain was just over $45,000. However, over 100 of the world's poorest countries had average annual incomes of less than $1,000 per person. This is far below Western poverty levels and inevitably leads to poor health. As Marxists like Laurie Wermuth have established, wealth equals health, which means that the poorer the country, the poorer the health of its population. In the course of the 20th and 21st centuries, the West has seen a major improvement in its health standards due to the introduction of better sanitation, nutrition, and healthcare. But the third world countries of Africa, Latin America, and Southern Asia continue to frequently have poor sanitation, which can include lack of access to clean water. Also, poor food security, with consequences from malnutrition to outright starvation. And healthcare resources, which are mostly restricted to an urban middle-class minority. Over 1 billion people in the third world lack proper drinking water. Over 10% of the world's population and over 20% of Africa's population live with chronic malnutrition, which has been connected to over half of all deaths in the third world. In addition, third world countries have problems with Western pharmaceuticals. Some are lacking altogether. Many are too expensive for all but the rich. And sometimes Western pharmaceutical corporations engage in the dumping of out-of-date drugs on poor countries. As a result of all this, over 10 million children die in third world countries every year from preventable diseases. Health has been found to correlate not only with the absolute availability of necessary resources, but also with their relative availability. In other words, health is not just related to income, but also to inequality. On a global scale, the 80s was a decade in which global inequality grew, and as it did so, global health declined. Internally, the more unequal a country is, the poorer its overall level of health. For example, the US spends far more than Japan on healthcare, but Japan's population is healthier and has a longer life expectancy than the US because it's a more equal society. In Canada, Juha Mikkonen and Dennis Raphael have estimated that Canadians lose about a quarter of their lives prematurely due to income inequality. Social equality improves society's health, both objectively and subjectively. Objectively, it means better living and working conditions for the majority, including better sanitation and nutrition. It also means a stronger welfare state, with a better social safety net, less poverty, and more accessible healthcare. Subjectively, it means better access to education, including health education, less discrimination against minorities, more interesting and fulfilling employment, and, perhaps most importantly, a greater feeling for the average person of being in control of their own life. That last point also relates to the nature of work in capitalism. Marxists argue that the capitalist labor process creates alienation for the workers. In pre-capitalist societies, people learned how to do their jobs as children, usually by helping their parents, so that as adults they could take charge of their own labor process. Nobody stood over a hunter telling him how to hunt or a farmer telling him how to farm. But in capitalism, the boss, or more commonly the management, tell the workers how to do their jobs. Workloads, deadlines, and goals are established from above. Independence, creativity, and self-expression are stifled. The workers are alienated from their own work because they have no control over it. They just spend their workdays following orders and established routines. All of this is harmful to their mental health. Being treated like a robot is not good for humans. Studies show that people need to feel in control of their lives, because if they do not, they experience anxiety, apathy, low self-esteem, and depression, which can also lead to physical health problems, including self-harm and suicide. Workers are happier when they have some say in setting the business's goals, and above all, when they have some autonomy in deciding how to perform their daily tasks. A reasonable workload, acknowledgement and appreciation of their work, opportunities for personal development, job security, and a good balance between work and personal life are all factors which contribute to good health, but which are all too often missing in capitalist enterprises. In the late 70s, Martin Shapiro applied the concept of alienation to his own experiences in medical school. He concluded that medical students were put through a process of becoming alienated from their labor, the product of their labor, each other, and ultimately, life as a whole. They were alienated from their labor by being given an enormous workload and little direction on how to master it, with the result that students never knew whether they had actually learned what was needed. They were alienated from the product of their labor by being taught to think of their patients as cases or objects rather than people. They were alienated from each other by a highly competitive system which pits students against each other instead of encouraging them to help each other. And they were alienated from life because they were tied to doctoring 24/7. Shapiro argued that medical students and doctors have to, quote, dock around the clock, leaving no time for personal life. Subsequent studies in the 21st century have confirmed Shapiro's findings and have concluded that such pressures cause medical students to have high rates of stress, depression, substance abuse, and even suicide. At the same time that they are taught to treat others' medical problems, they're taught to ignore their own. Capitalism also creates the ultimate act of workforce alienation, unemployment, which removes the individual from the workforce altogether. Before capitalism, there was no such thing as unemployment. There was a place for everyone, and everyone knew their place. Most people just took over their parents' jobs. But unemployment is a built-in part of the capitalist economy. In Canada, there are currently over 1 million people unemployed and many millions more globally. Unemployment is harmful to health, both objectively and subjectively. Objectively, it swiftly drops the individual into poverty, which leads to all sorts of health problems. Subjectively, it simultaneously separates the individual from their workmates and so imposes a degree of social isolation, and also takes away the individual's main social role and purpose in life. It may also lead to feelings of shame, humiliation, failure, and anger. The unemployed often feel as though they've lost all control over their lives. As a result, the long-term unemployed generally develop both physical and mental health problems. In the West, capitalism has increasingly put healthcare to the service of making a profit. Health has been made into a commodity with a market value. The healthcare system has become what's been termed a medical industrial complex, which is increasingly about selling products, medical equipment, prostheses, pharmaceuticals, and so on. Medical corporations put pressure on doctors to promote their products and on governments to buy their products. In the rush to get new products to market, less and less time is spent on testing for harmful side effects. Indeed, when corporate-funded research does uncover harmful side effects, the corporation refuses to allow the results to be made public. Most famous, or infamous here perhaps, is the tobacco industry, which spent decades covering up findings that cigarettes cause cancer, until the link became too widely known to deny. In addition, medical corporations promote the medicalization of a growing number of conditions not previously thought of as medical problems. Ray Moynihan has termed this disease-mongering. For example, when Merck & Company developed a new hair growth drug, they promptly sponsored news articles claiming that baldness was a terrible disease which caused great anxiety and suffering, but which could now thankfully be treated. And indeed, persuaded by this propaganda, many men have made great efforts to get their hair back. However, male baldness is a normal and natural part of life. I've been bald for many years now, and I've never felt the slightest anxiety or suffering over it. Of course, maybe that's because my job made me a natural egghead. But baldness is just one of many conditions which have been unnecessarily medicalized just to sell products. Youthful high spirits have been turned into attention deficit hyperactive disorder, ADHD. Sadness has been turned into seasonal affective disorder, SAD. Laziness has been turned into motivational deficiency disorder, MDD. And of course, there are specialized drugs for each of them. A related issue here is overprescription. The pharmaceutical industry claims to have a drug for every illness, and the 20th and 21st centuries have seen a steady rise in the share of healthcare money spent on drugs. Partly, this is due to the industry's aggressive advertising policy. It spends about twice as much on advertising as it does on research and development. But in practice, many new drugs are of little value, even if they don't have harmful side effects, because corporations rarely create genuinely new drugs. They prefer to create minor variations on proven formulas, which provide minimal additional benefits, but can have their price marked up significantly. Moreover, under corporate pressure, doctors often give out inappropriate prescriptions. In Canada, it's been estimated that between 1.25% of all prescriptions are inappropriate, and that in particular, between 1/3 and 2/3 of all prescribed antibiotics are unnecessary. Over 200,000 persons a year have had bad drug reactions. But despite this, the Canadian government engages in no monitoring of drug effects on an ongoing basis. Fully half of the drugs now on the Canadian market have never passed modern tests for safety or effectiveness. The government simply takes the pharmaceutical corporation's word for it that their products are always safe and effective, despite the historical evidence to the contrary. For the elderly, as the ailments pile up, so do the drugs. As doctors increasingly specialize, each prescribes their own drugs, often with little regard for harmful drug interactions. In Canada, about 1 in 5 of the elderly have had to go to the hospital due to health problems caused by inappropriate prescriptions. Studies also show that the elderly metabolize drugs more readily, and so should be given children's doses of medication. But in practice, the elderly are the most heavily medicated segment of the population. And as prescription drugs become reclassified as over-the-counter drugs, society as a whole becomes over-medicated, so that pharmaceutical corporations can make the enormous profits which they do. Another part of this issue is that medical corporations spend very little money researching or promoting measures which could prevent illness. Because if the general public doesn't get sick, then those corporations can't make money off them. Most research is on treatment, not prevention, even though prevention would serve society better. Occasionally, Western governments do run public education campaigns to promote healthier behavior. But again, very little is spent on them. In addition, in the late 20th century, Western governments introduced major cutbacks in healthcare spending and told the general public that health and healthcare are to be increasingly the responsibility of the individual, a strategy which has been termed responsibilization. This tactic directed public attention away from the social causes of poor health created by capitalism, like unemployment, poverty, poor living conditions, poor working conditions, and so on. Individual lifestyle choices, particularly pertaining to diet, exercise, alcohol, and drugs, were emphasized over environmental and social factors. For Marxists, this is all an exercise in blaming the victim. First you put people in an unhealthy situation, then you blame them for getting sick. Moreover, the flip side of this argument also serves an ideological purpose for capitalism. Good people with good lifestyles have good health. So, the better health of the rich supposedly demonstrates their moral and social superiority. They must be good people because their health is good and they look good. This logic does not actually follow, but it sounds persuasive to some people. The late 20th century also saw the growing privatization of healthcare in the West. Effective national healthcare systems were set up for the first time by Western states in the years following World War II. The late 40s, 50s, and 60s saw the creation of the National Health Service in Britain, followed by Medicare in Canada and on a smaller scale in the US. But following the right-wing takeover of the late 70s and early 80s, state-funded healthcare faced major cutbacks, and private healthcare corporations were encouraged to grow, particularly in the US. Doctors, clinics, diagnostic units, and hospitals were all increasingly changed from non-profit to for-profit. As Pat and Hugh Armstrong established, private health corporations systematically undermined state-run healthcare in both Canada and the US. They did this because private businesses always want to grow so as to increase their profits. But when healthcare is already being provided by the state, the only way for the private sector to grow is to destroy state-run healthcare and replace it with corporate healthcare. And so healthcare corporations have grown richer as Medicare has been starved of funds. But Marxists like Maud Barlow argue that, quote, profit is not the cure. The introduction of the profit motive into healthcare can only have disastrous consequences for the health of most of the population, because the market operates on the basis of ability to pay, not need. So, the rich, who have the healthiest lifestyle and so the least need for medical resources, get the lion's share of them, while the poor, who have the poorest health, get the least. In the US today, the richest 10% of the population receive about 3/4 of all medical resources, leaving the other 90% of the population to share out the remaining 1/4, leading to all manner of shortages. Privatization has already led to the creation of a two-tier healthcare system, particularly in the US. There's one healthcare system for the rich and another for the rest. Those that can afford it get the best healthcare in the world, but the other 90% of the population have to make do with rich people's leftovers. Privatization in the US has meant higher prices, fewer services for most people, and millions of Americans with no health insurance whatsoever. Growing inequality of access to healthcare resources is an inevitable consequence of allowing the profit motive, the market, and corporations to increasingly run our healthcare systems. Privatization of healthcare has only increased the pre-existing tendency for the wealthiest to also be the healthiest. The wealthy can afford more nutritious food, schedule more healthy exercise, live and work in a more sanitary environment, and now they can also buy the best healthcare available. As with all social structures in capitalism, our healthcare system does serve the needs of everyone, but it serves the needs of the rich first and foremost. That concludes what I have to say on the Marxist approach to health and healthcare. A transcript of this talk is available if you're interested. Good day.